Let's get going. Welcome everybody to today's Research Governance Showcase webinar. I'm Kate Warren, I'm Consultant in Public Health at the City of Wolverhampton Council and the Royal Wolverhampton NHS Trust. And I'm also funded by NIHR through the Specialist Centre for Public Health as a Public Health Engagement Lead for the Black Country, Herefordshire and Worcestershire. And I'll be chairing today's Showcase webinar. It's brilliant to see so many people on the call. It should be a great session. We do still have a few people joining the call or waiting in the lobby. So the numbers keep going up, which is brilliant to see. A few housekeeping notes before we get started with the presentations. This webinar today is being recorded, so if you don't want to appear on the recording, please keep your camera off. Could everybody please keep their microphones on mute unless you're presenting? And we are going to have time for questions after the presentations. We've got a panel Q&A session planned for later in the webinar. So if you think of questions during the presentations, please just pop them into the chat and we'll get round to answering those in the panel Q&A session. Or if we run out of time during that session, we'll answer those questions following the session. We'll get back to you via email. We will be sharing slides after the webinar, as well as asking for your feedback. So onward with the webinar, I'm delighted to welcome colleagues from local authorities across the country who are going to share their experiences of developing a research governance framework. They're going to talk about the rationale behind carrying out this work, the process involved, and they're going to be giving us some practical tips for others embarking on a similar piece of work. So if you're thinking of doing similar in your own local authority, this is going to be a great showcase webinar for you today. So we've got three speakers who've each got 10-minute presentations. So first, I'd like to introduce Rachel Murphy from North Yorkshire Council. Rachel is a qualified social worker and she's got a wealth of experience in research. In 2023, Rachel was awarded an NIHR doctoral fellowship, and she's completing a PhD alongside remaining involved in the council research development work. Over to you, Rachel.
Thanks, Kate. Next slide, please. Thank you. So, yeah, thanks for joining everybody. I'm Rachel Murphy from North Yorkshire Council. Next slide, please. Thank you. So just regards to the research governance framework in North Yorkshire, just to give a little bit of context of how that's developed. Prior to 2022, we had quite ad hoc and uncoordinated research activity across the council. You'll see HAS on the slides. That stands for Health and Adult Services, which is the directorate that I work in, which is Adult Social Care and Public Health. We did have research governance processes in our children's services, which is CYPS, but across other directorates it was quite inconsistent. And then in 2022, I was fortunate enough to sort of get some funding to be in a role for 12 months where I could lead on this, lead on developing research in our directorate. So we started talking about the governance framework then, developed it, and it was implemented in 2023. So the framework I'm going to talk about initially was just for our directorate in HAS. But then in 2024, the council secured HDRC funding, and that's Health Determinants Research Collaboration. And the intention from that funding is to develop the infrastructure and the research culture across the whole council. So there's now another piece of work going on through that, where we're actually co-designing a council-wide research governance framework. And that'll be implemented early next year. Next slide, please. Thanks. So back in 2022, when I was looking at this, the problem that we identified was that research requests were coming from all angles, from academic partners into our directorate, and there was no due process for managing this, no governance procedure. And when I looked at it, there was inconsistency in managing the requests. Quite often it was just odd people here and there that were saying yes or no. There wasn't any mapping or tracking of what we were doing, which was then risking work being duplicated or not addressing where we actually wanted research gaps filling. And the findings from a lot of the research weren't being shared widely across the council, so we weren't really getting the impact from it. And also just this lack of due process potentially posed a risk to everybody that was involved in the research because there wasn't that oversight. Next slide, please. Thanks. So the solution we came up with was to implement the HAS research governance framework, which would enable a single point of contact for all research requests and a formal review process for us to go through to review them and grant approval. And it'd be a consistent, systematic and proportionate approach that we could use for both internal staff and external researchers that wanted to work with us. And it just enabled quality assurance so that we could have confidence in what we were becoming involved in, and it enabled us to be able to track and map what we were doing. Next slide, please. Thanks. So this is an overview of what the research governance process was that we introduced. So we developed paperwork, which was like application paperwork, that's available on our internal website, and people would submit that once completed to a central email address. The documents are then reviewed by research governance coordinators. So that was myself and a couple of colleagues from public health that were looking at research in our directorate. And then we'd then decide what stage of review it required. And this generally was determined by the nature of the research, the level of risk potentially, if they were wanting to interview vulnerable people or if it was just sending out flyers or, so depending on what came up in the paperwork, we'd determine the stage of review. And we'd then conduct that review. I'll talk through these a bit more shortly, and then ultimately either approve the request or decline it. And then we'd record the project on a research log so that we could then have that consistency of communication and tracking where the research is going. Next slide, please. So the request forms that we send out to people, there's an approval application form which asks for these different things that are listed, along with any other documents to be sent through, like if they've got interview schedules or anything like that, any supplementary material. And we send them a self-assessment risk tool where basically they go through and answer questions on these categories to determine if they consider these areas to be high, low or medium risk. For example, researcher competence, if it was somebody brand new to research, that might be quite high risk if they were wanting to interview people, but then we'd look at the mitigating factors and they'd put those in, so they might have a good strong supervisory team, so we just use that to weigh it up. And we also send them our sort of in-house data protection impact assessment screening as well to look at. Next slide, please. So the different stages of review that we introduced, stage one would just be myself and colleagues from looking at research in our directorate who could then determine if it was to be approved or not. That's for very low level, light touch involvement in research. Most requests seem to come through to our research advisory group, which is stage two. So there's a list there of the sort of job roles of people that we've got involved in the research advisory group, and this is so that we can get different perspectives on the research, different viewpoints from people that would have relevant input and perspectives to share. We need to have at least 4 people there for a decision to be made, and we always invite the relevant people from whatever service area the research relates to as well. So if it was to do with mental health, we'd have the mental health head of service there as well. And the third level, HAS-LT, is our health and adult services leadership team. So that's the sort of AD, director, heads of service level, if it was deemed sort of high risk, too complex or high risk for us to determine. Next slide, please. And what we use when we're deciding on whether or not to approve a request is we've got a tool to assist with the decision making, which we call the prioritisation framework. And these are the different things that we look at. So we're not an ethics panel, but we'd want them to have ethics in place, having achieved that from elsewhere from the universities usually. But we're looking at it very much with the North Yorkshire Council lens. So does it align with priorities? Is it something we're already involved in? And a big one is around the staff commitments and resources. So like, what are they actually asking for, and can we accommodate it? So we always make sure that we have those discussions with service areas, and we go through those things when determining the outcome. Next slide, please. And then, as I said, we record everything on a research log. So this is now a central record of all the research activity we're involved in. And this just helps us keep track of what we're doing. We give every project like a reference number, so it's easy to communicate with the different researchers and keep files together. And what's really important here is that we're able to capture the research outcomes, so that when research is completed, we make sure we get any outputs from that. We invite them to come in and speak to relevant people, and we can make sure that we've got that impact. Next slide, please. So up to like more current now today. So we're now looking at the HDRC council-wide research governance framework, and this is important for us to develop because the HDRC is aiming for council-wide involvement in research and increasing research activity. So we want to make sure that the framework fits for all of the organisation, not just our directorate. And it'll help sort of us work together on projects across directorates and collaborate better, because it has been challenging at times having a different one for children's than we have in health and adult services when projects cross both directorates. So this will streamline everything. Next slide, please. So the proposal that we're now working on is around modifying our health and adult services research governance framework and accommodating the learning that's taken place over the last couple of years while we've been rolling that out, as well as drawing in expertise from other directorates. So that's our approach to developing this. We're going to modify what's not working, consider new ideas from colleagues in other directorates, and our children and young people services have welcomed this, because like I say, it's been a bit challenging sometimes having different frameworks that we're all pulling together. Next slide, please. So what we're currently doing, we know what works well, which are having the definitions of research, the scope of the framework, having like diagrams and process maps in our documents, providing like principles to follow when conducting good research, having that generic mailbox has been really useful, so all contacts come through that, having the application form and the different stages of review so that you can have a proportionate approach. They've all been really useful. But we know that there's a few things to modify. We know that the new one will have to reflect the research vision for the whole council. We know we need to make some modifications to the risk screening tool so that it's more reflective of sort of risk before, mitigation, and then risk after, and sort of consider that a bit better. That's been a bit clunky. We want to automate some parts of the process because it's just sort of Word documents and PDFs at the moment, and have a more joined up approach with data governance. So we have noticed that having the sort of separate DPIA checklists and then sending them to colleagues in data governance to look at that aspect and then waiting for that to come back, that again has been a bit clunky at times and can be quite time consuming. So what we're going to add to it, to the process, we want it to be relevant to all directorates. We wanted a more diverse membership on that review panel because the one that we set up was very specific to health and adult services. So we're looking at like different directorate members coming together for that. We want to have a public facing page about research governance so that there's one front door, because again, we haven't got that far with our current one, but that's the vision for the council wide one. And we're looking at different processes for different requests that come in, because as it stands, all requests are following that one process. But again, sometimes people might just want projects advertising, so we're trying to make those even more light touch, and different processes for different researchers, because again, sometimes like internal researchers might be very different to consider than a brand new partner that we've never worked with before. So we're looking at different processes for those. Next slide, please. Thank you. So that's it from me. My colleague Jess is on the call as well, who's leading on the council-wide research governance work. So you're welcome to email either of us, and we'll be happy to share the council-wide research governance framework once that's completed early next year. But if anybody wants a copy of has one in the meantime, even though that is being updated, please contact us directly and we'll share that. Thanks.
Thank you ever so much, Rachel. For anybody who's joined since we started the webinar, we will have chance for a Q&A session after our three presenters have finished. So we're going to move swiftly on to our second presentation now. I'd like to introduce Parm Dhillon from City of Wolverhampton Council. Parm is a principal public health specialist. He's got over a decade of experience in public health intelligence, and he's chaired the City of Wolverhampton's Research Governance Panel for the last 3 years. Over to you, Parm. Thank you.
Thank you. So yeah, as Kate mentioned, my name is Parm Dhillon, Principal Public Health Specialist, and I've been asked to talk about our research governance process that we've got in the council and how we've developed it. So I've been involved in research governance for about 7 to 8 years, having had kind of leadership of the area for the past 3 years. So yeah, if we could get the next slide up, please. So in Wolverhampton, we're a pro-research organisation, and I think the following quote kind of describes that ethos that we have in Wolverhampton, and it's that research is a core function of health and social care, and it is essential for our health and well-being and for the care that we receive, and that's from the Health Research Authority. However, we are keen in Wolverhampton to ensure that any research that takes place within the council, through the council, is of good quality, ethical and useful. Given the risks that are involved with poor quality or unethical research, we think it's vital that we do have a stringent process in place to enable us to do that. And this process ensures that prior to research taking place, researchers have taken reasonable actions to protect the rights, safety and well-being of any service users, families, carers and staff that may be involved in the research as well as themselves as researchers. So yeah, if we can get the next slide. So this current process that we've got has been in place since I think it was literally Christmas 2019 it went live. So prior to that, so pre-2020, we had a very light touch process that was in place. So this is the process that I inherited when I first sort of got involved in research governance, and all we required was evidence of ethical approval, some level of evidence of indemnity insurance, approval from the service lead, which was our responsibility to seek. That was it basically. So it wasn't very thorough. So therefore, for us to achieve the outcomes that I mentioned in the last slide, we needed a new, more robust process in place. If we can get the next slide. So at the end of 2019, so 2020 literally onwards, we put in place this new process. And the process involves the requirement for an applicant to complete an online application, which is made up of 2 forms. So part A is actually only required if an applicant does not have a research proposal or for whatever reason does not wish to submit it as part of their application. And the part A kind of explores the kind of information you'd expect to see in a research proposal, such as the research organisation, individuals that are involved in the research, any sort of funding from third parties, the research question that's actually being explored, who the participant pool is, and what analysis methods are going to be used as well. And then part B, so part B has to be completed by all applicants, and this explores the more practical aspects of the research, such as planning of how the data is actually going to be collected, informed consent from the participants, and data storage as well. We also require evidence of ethical approval, indemnity insurance once again, participation, a copy of the participant information sheet, a copy of the consent form, and then we also seek approval from the service lead as well. If we can get the next slide, please. So in terms of, in a bit more detail now, what does the new, more robust process actually explore? So it explores planning of the research methods. So we want to make sure that the researcher has actually has actually thought about whether their chosen data collection and research methods are actually appropriate for their participants, and have they actually involved them in making that decision. And we also want to know what experience researchers have of using those methods as well. We seek to get assurance around fair participant recruitment to ensure there's no bias when it comes to recruiting participants. And if there is any criteria that your participants must meet, what is the rationale behind that criteria? We seek to ensure that participants have the ability to withdraw or complain, and we seek to have evidence that the information required for the participant to withdraw or complain is readily available, and if there's any time limits in relation to withdrawal from the study, those time limits should be clearly stated as well. We also seek informed consent and we also explore safeguarding as well. We explore how the researchers will obtain informed consent from the participants. And also for research topics that are potentially more sensitive or have the potential to bring up past trauma, we expect to see protocols in place to support the participant as well. And then also dissemination of research. So we expect to see that efforts are made to ensure that the research is disseminated in a way that's appropriate for participants, should they wish to see the research afterwards, and also colleagues across the council as well. And we also request that the research is shared with us as well, for us to keep on record following completion of the research. And then I think quite a big one is information governance as well. We like to see that the researchers have taken GDPR principles into account, and that they're planning on taking the relevant measures to ensure that sensitive information is going to be kept securely as well. We can get the next slide. And just a bit about a run through of how our process actually works. So initially, the applicant will access the research governance application guidance, which is available online on the council's website, and then they'll go ahead and complete the application form online. The applicant will be requested to attach a copy of their research proposal and supporting documents to their application form. And we also request that applicants email the research governance inbox to inform us of their submission, just in case there's any lag in us checking the online portal, so we don't miss any applications or no applications are delayed. Then the application will be acknowledged we aim to acknowledge it within 5 working days of us receiving it. And any initial concerns will be raised, such as any missing documents. For example, if they've not attached any evidence of ethics approval, we'll either seek to ask them to attach it, reattach it, or ask sort of why that's not yet been attached, or if they haven't yet sought ethics approval. Once any outstanding documents have been received, the application will be reviewed by a minimum of two members of the research governance panel. There's currently 4 members of the panel, but as long as 2 of us are available, we will be able to assess the application. The application will also be discussed with the service lead for the topic area that your research is going to be involving, and then the applicant will be notified of a result within 10 working days. Now, there's 3 possible outcomes from the application. The first one is not approved, so we will provide feedback on why the application hasn't been approved and what the applicant can do to reapply. Now, this will be the case if there's significant changes required to the research methods, or if there's big gaps in the research methods, such as the not including a distress protocol if we deem it necessary. The second outcome is approved with conditions. So this is where we're happy to approve if a few minor changes or minor amendments are made, such as if we require a slight change to wording of the patient information sheet. And then the third outcome is just being approved. Now, in the 5 or so years that we've had this application process in place, we've probably given a direct approval once. I think that just demonstrates, I suppose, how thorough we are with the process. And then once they've received approval, once they've received approval, they can begin their research. And like I said, they'll be expected to supply a copy of the executive summary. And we've yet to receive a single executive summary in the 5 years we've been doing this. If we get the next slide, please. So a few reflections on developing a more robust process. So it can be quite time consuming. I'd say on average between 2 to 3 hours per application in total, with some follow-up occasionally required. It's definitely more admin intensive, with a mailbox to monitor and ensuring that accurate records are kept as well. We must ensure that the panel is trustworthy and works with integrity, but also not afraid to challenge each other's points of view, which does happen often, although we try to ensure things don't get too heated. And we also anecdotally we understand that researchers have actually found it a beneficial process to go through, even though it's an extra hoop to go through and a bit of a chore. It makes them think about aspects they may not have considered and enables them to develop better quality research. So yeah, thank you. That's all from myself.
Lovely. Thank you ever so much, Pam. Right, we're moving on to our third and final speaker, our final presentation, and then we'll have the Q&A session. So our final speaker is Paige Hurlston from Kent County Council. Paige is a local authority research practitioner and research, innovation and improvement portfolio lead. She's contributed to the development of a tailored research governance framework and a digital portal, enabling streamlined approvals and integration with NHS systems like Edge. Over to you, Paige.
Thank you very much for my introduction. Hello, good afternoon, and thank you for inviting me to talk today. As I've just been introduced, my name is Paige Hurlston and I work for Kent County Council as the Local Authority Research Practitioner, or LARP, for Kent County Council. Next slide, please. I'm going to talk today about how we got started on our research governance journey to where we are now. It's more of a story around the challenges we faced and what we've done, rather than the internal nuts and bolts of our governance framework. But if you do have any questions around that, I can speak via email afterwards. So I'll take you back to the beginning of our official research journey at Kent County Council. It has taken a slightly unique path, and therefore our activities and our processes do look slightly different to other local authorities. If we head back to the end of 2022, Kent County Council invited Editor McCallum, the head of research at Medway Hospital, to join us on secondment to develop and implement a research, innovation and improvement strategy, with the goal of enabling KCC and our associated district to become more research active and improve our frontline practice. Next slide, please. Thank you. So first things first, Editor set to work with the initial task of gathering our decision makers. So we established a dedicated research governance committee within the local authority to ensure oversight and strategic alignment of research activities. This is made up of representatives from public health, so our Director of Public Health, we have public health consultants, we also have the Director of Adult and Children's Services, we have legal, information governance, everyone whose voices need to be heard within our research governance framework. We meet quarterly and we review research projects, ensuring they align with our priorities. We monitor progress and risks. We occasionally conduct ethics review for low-risk projects, and we support effective data sharing and governance. I must say, I've just made it sound really easy. We just put together a committee and off we go. That wasn't how it went. We tried, we stumbled, we learned. After the first meeting, I wasn't sure how we were going to move forward. after all, research in wider care settings is relatively new, and there aren't national frameworks that we can just pick up and implement. All of us together are paving the way, and with that comes challenges. One of those challenges that we found was language. In research, when we're talking about governance, we're referring to the framework of policies, standards, processes that we adhere to ensure that research is conducted ethically, legally, to high quality standards with patient safety at the forefront, making sure that they're indemnified and so on. When we're using this language to directives in a local authority setting, it can mean something completely different. So when we were speaking about governance, they assumed that we were speaking about an accountability structure rather than a process. So that was something that was really important to us, and realising that there's education needed here both ways. So allowing the council to educate us and us educating the council on research processes and language to make sure that we're all on the same page and that there is clarity around our intentions here. Next slide, please. Thank you. Next, we had to make sure we understood where we were. We completed some initial scoping exercises. So what research-like activity was currently happening? What processes are currently in place? We found there is so much research activity going on. However, it wasn't always described as research by the staff we were speaking to. So we'd go in and we'd say, what are you doing? Are you doing surveys? Are you doing engagement with your local populations? And they'd say, we're not doing research, but we are doing, and then they would proceed to tell me all this amazing research that they were undertaking. And what we found is that people's perceptions of research just didn't match with what we would describe it as. So often people think of research and they think clinical trials in hospitals, and they're not doing that. So they're not doing research, which obviously we know is untrue. So this is another example of how language can be a barrier when we're trying to support research in local authority settings. So something we thought was really important was finding a definition that worked for local authority settings. And you can see that here in the yellow box. And when we shared this, suddenly there was a different attitude towards research, and people felt as though actually we are doing this now. We do need to be involved. We do need support from the research team. So we know research is happening, but as others have mentioned, there was no central record to know exactly what was happening, whether governance had taken place, if there's a system in place to feed back and share the findings, and so on. So whilst we're working out how to put a governance framework into place, we began recording all of our research projects that we'd come across into a basic Word document. And we soon came to regret it. We had over 200 projects sitting in a Word document with no way of managing it. So what we had to do from here, develop our research governance framework and have different strands on how we manage that. So we have two main strands. We have the NIHR portfolio projects. Sorry, next slide, please. Which are pre-existing projects on the National Institute of Health and Care research portfolio. Most of these studies have gone through HRA process already. So this includes ethics, it includes many other checks before we have to do a governance review on it. This is still checked on a case-by-case basis. These are ideas that are funded by external bodies and are managed, including governance, on our EDGE research management system, which I'll talk more about shortly. We also have our non-portfolio studies. So these are homegrown studies initiated by our own public health team, or commissioned services, for example, BCSE organisations, or student projects from local universities. And we manage these through our central research management portal. Next slide, please. So here is the front page of our governance portal for non-portfolio research. This is a portal which is an outward-facing online platform. It's the front door, as someone mentioned earlier, for our research governance process for anything non-portfolio. It simplifies applying for approvals for researchers, academics, students, and internal staff. We've integrated this with the HRA tool that helps users determine if their project qualifies as research and guides the next steps. It also then has distinct workflows for the different categories of research that we support to make sure that there is efficient and appropriate management. Requests are then directed to the appropriate team to work through the HRA's guidance for reviewers of research based in settings outside of the NHS, which is always a mouthful. I'm more than happy to share the HRA's guidance, which we found really helpful and has really streamlined our processes within KCC. On to the governance for portfolio projects. This is slightly different, and for those who aren't familiar, Edge Research Management System is a software designed to help people and organisations manage research projects more easily and efficiently. Imagine it as the digital control centre for research. It's used across the NHS to support their research governance, and we've lifted the model, made some workflow alterations, and are now implementing it in KCC. We use Edge because it gives us a simple, secure platform to record and manage all our research activity. It also feeds directly into NIHR systems, which reduces the need for duplication. It helps us to track our projects, monitor progress, and ensure compliance with governance standards. It makes it easier to share data across teams and enables us to search for projects. So horizon scanning, essentially. If you've got a particularly research active consultant who's really keen on being involved in research in the frailty area, for example, you can search by specialty for research already going on in the area and request to be involved via this Edge system.
Just one more minute. Thanks, Paige.
Thank you. Ultimately, it streamlines our processes and strengthens our evidence base to improve outcomes for our communities. To do governance checks on here, next slide please. We simply log each project, apologies, next slide again, I must have forgotten about that one. We simply log each project on the platform and complete the required governance checklist, as you can see on here. It asks for checking consent forms, ethics, indemnity insurance. It helps us to track approvals, monitor compliance, and we can flag any issues really early. So we are still in the early stages of using Edge at KCC, and we aren't making full use yet of its capabilities like our NHS colleagues, but we're making steady progress. Our NIHR portfolio projects are managed this way, and we are making the transition for all of our research portfolio to be on Edge. The next step is having our consultants sign up so they can request approvals directly instead of relying on paper documents and prolonging the process. Next slide, please. Thank you. So let's remember those research active NHS trusts that we look up to and compare ourselves to didn't start out with perfect systems, frameworks, or endless capacity. They began somewhere, just like we are now. We can't simply copy and paste their methods, but we can learn from the successes and their missteps. And what we build won't be identical, but it will be ours, and it will be tailored to our community, shaped by our values and driven by the ambition to make research part of our everyday practice. It is a long journey, but seeing the research culture grow and hearing words like evidence, evaluation, etc. as part of everyday conversations in the council makes every step worthwhile. Next slide, please. Thank you for listening. I have included my email in case anyone would like to get in contact. I'm aware I didn't go directly into the details there around our framework, but I just wanted to give a different perspective on governance and that it's not always straightforward and easy to implement. So thank you.
Thank you, Paige, and thank you to all three of our speakers. And we're now going to have a Q&A panel with our three speakers, and we're also going to be joined by Daniel Gibbons. Daniel is HDRC Research Officer at Cumberland Council, and he's going to join us for the Q&A. So we've got a huge number of questions that have been flooding in through the chat, which is fantastic to see. Leslie's been keeping track of them and is going to read them out. So you don't need to come off camera or come off mute. If you can just stay on mute, please, so that we don't get everybody talking over each other. And Leslie, do we have the first question for the panel, please?
Yeah, sure. So the first question is all about ethical review, because we've had quite a few questions along a similar theme. So the question would be, how do you approach the requirement or need for ethical review for internal research that may not involve a university partner?
Yeah, Paige.
Thank you. So that is part of our governance committee responsibilities, particularly if it's a low risk project. So we would have members of our governance committee, and we would also invite the specialty leads for that area and conduct an ethical review on the low risk projects. Those that are more high risk tend to involve the NHS. So we'll go through the HRA process and have an ethical review process done that way. So that's how it's managed in KCC.
Thanks, Paige. Palm?
Yeah, so I think our process is ever evolving. I think we take into account capacity of the panel and so on. So currently, if a project, an internal research project, is sort of categorized as business as usual, and it's not being used for a dissertation or a third-party research project, we wouldn't require them to do the research governance application. However, we're there to support them and sort of help them develop their processes. So at the moment, it's the research governance application is only required if it's the research is being done by an external organisation or by an employee that's involved with an external organisation, such as a university dissertation project or master's research or other research.
Thank you, Palm. I think it's interesting to see the different approaches depending on whether you have that additional capacity through an HDRC, isn't it, which City of Wolverhampton Council doesn't at the moment. Thanks, Rachel.
Yeah, I mean, overwhelmingly, people are linked in with universities that are applying for us, so they've gone through ethics that way. But what we offer is that we'll support them through the HRA process if they're not linked in with a university, because that can be quite difficult to navigate. But now that we are a HDRC, we are looking at potentially in the future developing ethics, an ethics panel as well as the research governance. But we're not at that stage yet, but we've sort of recognised that might be helpful in the future, particularly as staff get more research active.
Thank you, Rachel. Daniel?
Yeah, I guess I just wanted to come in and kind of talk about what we did too. So I think something similar. We kind of, I suppose I want to speak from a local authority that has not a very kind of far along research infrastructure. So we tend to get quite a lot of projects internally that might not have academic partners initially. So obviously part of our role is to do that linking up. But sometimes when they're not required or projects aren't going for kind of publication externally, we can kind of review that ethically internally through our HDRC team. So that's kind of the process that we take. And obviously we've got similar to some of the flowcharts and things that have been shown today, we kind of have our own process of risk management and what needs reviewing by who. And if necessary, we'll get, our kind of service managers involved, the HDRC manager or directors of public health, for example. So yeah, that's what we do.
Thank you very much. And I think I'm right in saying that the RSS, the Specialist Centre for Public Health, are looking for people to share their processes and their approaches. So if you think you're doing something slightly different or you've got a robust method, then please do share it with us after the call. Leslie, we're on to the next question.
Yep, sure. Okay. So someone said, we found so much research activity that happens in local authorities is evaluation. How is this considered in any process? Do evaluation activities go through the process?
Yeah, such a great question, isn't it? Real life research in local authorities. Paige.
Thank you. So I saw the question in the chat and this resonated with me so much. As I mentioned, a lot of the staff in the council didn't necessarily consider evaluation to be research, but for our definition, we've decided that it definitely does. And we use the same processes. So it would be categorized under non-portfolio research. We would still go through the processes of checking that it's safe, ethical, etc. But it is considered research from our point of view.
Thank you, Paige. Rachel?
Yeah, we've had real issues with this as well, and sort of it sort of led into the discussions between local authorities around this, led into that piece of work around defining research in a local authority context. The way we do it, we wouldn't have had the capacity with our initial research governance framework to do every put everything through that was an evaluative piece of work that was in-house being done. So we just very much look at it as a case-by-case basis at the moment. We don't want to make work for people, ourselves and others, if it's business as usual and it's like an evaluation within service development, the processes. So we sort of look at it very individually as to what it is that's being proposed, and have those initial chats with people before saying, yeah, you need to fill in the paperwork or not. So, but I think it's still something we're trying to sort of iron out as a concrete decision, really.
Thank you, Rachel. Anyone else want to jump in on that point before we move on?
Yeah, I mean, happy to jump in on that point. But yeah, our process is similar to what Rachel's described as something I think we debate every now and again, but we treat on a case-by-case basis. And even if we deem that that research governance application isn't required, we're still there to support the colleagues that are undertaking that evaluation.
Thanks, Paul. Lovely. Right, on to our next question. Leslie?
Okay, there's so many great questions, it's really hard to choose. So at Coventry, our research governance framework is new, and we're thinking of ways to promote the framework and to encourage staff to use it. Have you experienced any difficulties, and how have you approached it?
Oh, that's a great one. Rachel?
Yeah, this was a big challenge when we first implemented ours because, we weren't a HDRC. It was sort of me developing it and then trying to promote it across a directorate and get the word out there. And I think that the communication is really key in getting people to be aware of it and that this is a process to now follow. The way that we managed to do it was sort of directing communications to frontline staff, particularly those that are interested in research, potentially would be linking in with projects and things like that, but then also going to hire more senior management. And so we did a presentation at senior manager events and things like that, so that they also were aware, because it was just important to pick up all those people that potentially might be approached about a project or think they want to do a project themselves, and for them to know there's now this process to follow, and just sort of promoting even that central mailbox, direct everything to that, any queries you get to that. So even if people weren't totally familiar with the whole process, they didn't really need to be, because we would then pick that up. But I think that sort of, all different staffing levels being aware sort of helped us to get that message shared.
Thank you, Rachel. Daniel?
Yeah, I think we've kind of tried to do similar dissemination activities, and obviously it does make it a little bit easier when you have the HDRCs, you have a dedicated comms person, or you have more channels into those internal and or kind of partner comms as well. But we've absolutely had challenges when it comes to people actually filling out the forms. I've had a few emails saying, is this something that you guys can kind of do for us, instead of us having to take, and it's at the end of the day, I see it because there's more red tape. I think at Cumberland HDRC, we've tried to kind of be as loose touch as we can be whilst making it ethical and safe. We've also endeavoured to produce quite a few kind of how-to guides and supportive forms, and we obviously offer a lot of our time to walk people through the forms and to discuss methodology, ethics, practical delivery, information security, all of that stuff with staff. It's certainly a challenge. I think that one of the best things that we do is kind of framing it as a supportive process, and trying to kind of encourage people how much it will improve the kind of the shape and the success of their project, I guess, which obviously sometimes works. But that's what we do.
Thank you, Dan. Yeah, so important that it's a supportive process, isn't it? Pam?
Yeah, I think from our perspective, I think research that's coming from an experienced research body such as universities and so on tend to know that a process is in place, and there hasn't been any much reluctance from that angle. I think any reluctance or any persuasion that's been required has probably been internal colleagues, and obviously they see it as another hoop to go through and kind of more red tape, as Daniel said. But I think again it's about explaining the benefits to the organisation and to them in actually going through our process and having, like Daniel said, that supportive nature. as well. So so yeah, similar perspective to Daniel there.
Thank you. And Paige. Oh, you're on mute, Paige.
Thank you. Echo what everyone else has said in the fact that we've promoted it as a very supportive process. It's like, hi, we're the research team, we're here to help you, and this is how we can help you. We also have a monthly newsletter that we send out that highlights all of our research activity, and we've included it on part of that. We have a Padlet as well, which is an external facing site, I suppose, again, that captures our research activity. We include our frameworks on there. We also have worked really closely with our commissioners. So I think a lot of what we've spoken about today has been about our internal staff completing the processes and the frameworks, but also when it comes to our commission services, for example, health visitors or drugs and alcohol services, we've asked our commissioners to put it into contracts. So if you're looking to take part in research, please ensure that you're following our research governance framework. This is how you do it. When it comes to newly commissioned services, we make sure we have an introductory meeting. So introduce the research team, introduce the framework, and work out how we can work together to do as much research as possible, safely, ethically, and keeping a track of it all.
Thank you, Paige. We may have time for one more short question, I think, Leslie.
Okay, yeah, I've got a great one here. Interested to know what thought has been given to one local authority accepting the checks that another local authority has done in order to approve a study more quickly and reduce duplication.
Oh, that's an interesting one. Has anyone come across this scenario? Rachel?
I've not come across that scenario. I think the way that we currently do ours, we would still want to have like that review ourselves, because the way that our governance review works is like we're looking at it very much with the North Yorkshire Council perspective. So like we would want to know, for example, if they were wanting to access people in a particular community to do some work, like are we already doing that? Because we don't want to sort of bombard people. So we would have that oversight of what's actually happening in our region. And similarly, like I mentioned in my presentation about having like resources to be able to support the research. So if it's been approved in another local authority, that doesn't mean that we necessarily have the staff and the resources to be able to do it in ours. So it's not something I've come across. I think like there'd be some things that, you know, you could probably much more brush over into terms of like, you know, they've checked the ethics and, you know, that sort of things. But I think the way we run it, we would want that North Yorkshire lens on it before approving it, just to look at our specific sort of what the ask is and whether we can accommodate all that.
Yeah, that makes sense. Thank you, Rachel. And finally, Paige.
Thank you. So I mentioned earlier the HRA reviewers of research in out of community settings. As part of that group, this has been part of discussions for a little while now. How do we reduce the burden on other local authorities when it's the same process that we're all undertaking? Like, is there a way of making it universal? So although it's not happening yet, I think it's absolutely in the pipeline. And from a KCC perspective, it would be handy to have all the basic checks done first, and then we could do a really light touch process. Does it align with our priorities? Do we have capacity and capability? And approve, rather than the whole governance process that we currently have to undertake for research. So not currently, but it's absolutely at the forefront of our mind to try and get this process as streamlined as possible and accept potentially other checks from other local authorities.
Thank you very much, Paige. We haven't had time to cover all the questions in the chat today, but what we'll do is we'll make a note of any questions that we haven't answered, and we'll try and get responses to these out over the next few days. I'm hoping you'll join me in thanking, giving a virtual round of applause to Rachel, Palm, Paige and Daniel for sharing your insights today. It's been a really helpful discussion, really useful, really interesting. I'd also like to thank Leslie, Laura and the team at the Specialist Centre for Public Health for organising these webinars and making sure everything's run smoothly today. We're going to end the session here, but thank you all for joining us, and we hope to see you on some of our future webinars. Thank you very much. Bye, everybody.